This, I'm one of them. I've just moved down from New York. I completed my residency. My medical degree is actually from Nigeria, University of Ibadan, so that's what's correcting her. So, I don't know, I'm a bit nervous, so just going easy. I don't know what you guys would like, but I just did a little presentation about well woman. So I don't know if you have any questions that you want to ask initially, or if you want to keep them till the end. Okay. So basically, the well woman exam is just when you come in to see the doctor for a routine exam. And a lot of people, once they get past a certain age, they don't feel it's necessary to actually visit the doctor anymore. But this is why I'm here, is just to talk to you, is just to give you a general idea. Now, part of the OBGYN experience is well, part of like a primary provider, because a lot of women will not go and see a doctor except there's something wrong. But they will come in to get their pap test. They will come and see the GYN for some reason. So that's why we call it a well woman, because then we can pick up problems and then refer them onwards to anybody else. So, I'm going to start by just putting into two age categories, because I was told I'd be speaking to a more mature audience. So why visit the doctor? So basically it's a routine health check. A lot of people may have medical issues, such as hypertension, diabetes, heart disease that they may not be aware of. They may be aware of it, but it may not be. There may be on medications that need to be checked and adjusted. They may need surgery, or they may have had surgery in the past and just for follow-up. And of course, reproductive health. Some people have stopped having periods, or some people are still having periods and have issues that they need to discuss with the doctor as well. So menopausal symptoms, a lot of people will be familiar with it. Hot flashes, night sweats, mood swings, vaginal dryness, problems with intercourse. You know, sometimes some people just need to talk about stuff to make sure everything is okay. And sometimes problems like bleeding after you stop having your periods, we call it postmenopausal bleeding, is also another thing. The average age of menopause in the US is 51 years of age, so some people are going through or have gone through their changes as well. And of course, you know, sexual activity is still prominent, but then at the same time, just because you're not having children or you're not at risk of having children, you can still have a sexually transmitted disease. So, and sometimes some people have not actually gone through their change. If you're still in your 40s or early 50s, there's a risk of getting pregnant, yes. I've had a 56-year-old lady have to give birth, so it can happen. And then incontinence, like you're originally scheduled to talk about, so there's urinary and fecal incontinence. And a lot of people find this embarrassing to talk about because, you know, hey, I'm supposed to have bladder issues. This is incontinence is only for babies, so why do I need to talk about this? You know, so it's very embarrassing. So what to expect when you come? And also, we also do cancer screening as well. So I just put down a list of the common cancers that we have now. Lung cancer being the most common killer, okay? Especially in people that smoke. Breast cancer, cervical cancer, ovarian cancer, uterine, vulval, vagina, and colon cancer, okay? And I put medical screening for diabetes. You may not realize that you're diabetic. You may have had the symptoms and just put it down to something else, or just stress or fatigue. But then it's always good to come and talk about it. Same thing with thyroid problems. They don't actually cause any specific symptoms. They may just cause non-specific symptoms like just being unusually tired, depression, you're not eating properly, you're constipated, so that's why we do that. Your lipid profile as well. A lot of people are overweight, they don't eat correctly, so their lipids are abnormal and they need to be on medication, and that increases your risk of heart disease as well. Osteoporosis, weakening of the bones, puts you at risk of fractures. If you're not careful, you're walking out, it's cold. We've had winter has come in, we've had some ice patches, you slip, you fall, you fracture your hip. That's one of the things that happens. Okay? Cardiovascular risk factors, so we said that we need to talk about. So you may be healthy, but you may have risk factors in your family. Somebody in your family, your father, your mother, your aunt, or something that had hypertension, diabetes, dyslipidemia, obesity, and then lifestyle, of course. Sometimes as we tend to grow older, we tend not to move around as much, it's more difficult, but we still need to exercise. Okay, we still need to get out there and keep doing stuff. My mom's in her 70s, and I always have to keep pushing her. No, you have to go out for a walk, you have to exercise, you have to do stuff. And then psychosocial health, family relationships, who do you live with, who's looking after you. Some people live alone, they don't have anybody to talk to come and visit them, they get depressed. Partner violence, neglect, elder abuse, it happens. Okay, we don't like to talk about it, but it does happen. So, coming to see the physician may be an avenue to bring it out into the open, and maybe we can help you. Lifestyle stresses, family moving away, changes occurring, you've retired, you're not doing anything, you're idle, you're thinking of, if you're used to being active, sometimes some people take being retired not so well. And then smoking. Now it's a hot topic everywhere. You see the signs outside, no smoking. So everybody's now trying to be encouraged to stop smoking, because smoking does more damage than good. All the cancers are associated with smoking. So what to expect when you come to see the doctor? So obviously the nurse is going to see you, ask you questions while you're here. They're going to do a physical exam, do your vital signs, the weight, height, BMI. It's a big thing now. We're being driven to calculate BMI. And basically what the BMI tells us is if you're at risk of being, if you're normal weight, if you're slightly overweight, if you're obese or morbidly obese. And it increases the risk of things like heart disease, diabetes, hypertension. And then when you see the doctor, you're going to get an exam. Most times, look at your neck, see if there's any swelling, examine your chest if you're having any chest complaints. The breast exam is also like a screening exam for breast cancer. The abdominal exam and pelvic exams are also like screening exams as well. So, and then most commonly everybody comes to expect is a pap test. Now I've had a few people come into the office and they tell me, oh, I'm here for a pap. And they had a pap last year, and I tell them, well, I don't have to do a pap again for you. And this is because last year, ACOG, which is the American Congress of Obstetricians and Gynecologists, changed the guidelines. So if you've had a series of normal pap tests, we don't have to do a pap test for you every year. We can do it every 3 years if they just do what is just a simple cytology pap, or every 5 years if they do the pap test with what we call the HPV testing. Okay? And then mammograms, screening for breast cancer as well, which we do every year from age 40. Okay? And how many people have had a mammogram within the last year? I say a few people have missed out. Okay? So which is important, because some people think, oh well, I've had a few, they've been normal, but you still need to have it done at least until you're 75, and then you can stop. The reason why these things are important is because as we get older, the risk of cancer increases. Okay? So within a certain age group, once you're over age, between the ages of 40 to 64, the most common killer is heart disease. Okay? But the second is cancer. So that's why we have to screen. And the thing about screening is that a lot of these cancers, if they're detected early, you don't have to die from them. There are treatment options that you can have, and you can live with them. So a lot of people are living longer because we're able to screen for cancer earlier, and we're able to treat them. I said these guidelines here are just for people who've had normal pap tests. And before you actually switch over to these guidelines, you have to have documented at least 3 consecutive negative paps. Okay, so you can't just switch over. So, if you've been going to the doctor every year for the last 3 years, you've had a pap test and you're all negative, then the doctor can say to you, I don't need to do this again. Some doctors will still do it, because if you switch doctors and they don't know anything about you, and they don't have a record, then they'll still do the pap test. Okay. So, we also do some blood tests. CBC is a complete blood count, and TSH is a thyroid screen, the lipid profile, and the diabetic screening as well. So the CBC is to detect if you're anemic. A lot of people, when they get older, their diet habits changes. So they tend to cut out some stuff, they tend to cut out some meat because they have indigestion problems with it. But you get a lot of iron from meat and vegetables, so you can be anemic as well. Okay, thyroid function, like I told you, if you have a thyroid disorder, it's commoner in the more mature population, and it has non-specific symptoms. So you may just notice that you've had a change in your bowel habit, you're constipated, you feel more tired, you're putting on weight but you can't tell why, you're more sleepy. Sometimes it could be a thyroid problem. Diabetes, very important, because the older you get, the more at risk you're getting of diabetes. Okay, so it's a blood test as well. And then colon cancer, colonoscopies, which everybody hates, okay? But it's recommended after the age of 50, you get one done every 10 years. If for some reason you can't get a colonoscopy, you can do a barium MRI every 5 years, or they can do a fecal occult blood, which is like checking the blood in your stool, and you do that every year. Also, screening for sexually transmitted diseases. Hepatitis, if you, I think in the early 80s, if you got a blood transfusion before then, the screening for blood transfusions was not as strict as it is now. So there's a risk that some people may have hepatitis and not realize that they have it as well. HIV, like I said, you're still sexually active. You never know. Most people think, I don't need to use condoms at this point in time. Hey, I'm not going to get pregnant. But there's still a risk of getting HIV. Okay? And then bone mineral density is a screen, and it stands for osteoporosis. So basically it gives us an idea if we need to give you calcium, vitamin D. And the risk factors for this are mostly Caucasian or Asian women. Okay, if you're slim build. Alcohol, if you take a lot of alcohol, or if you smoke as well. And then immunizations, yes. Flu vaccines. Did we get our flu shots this year? Yes. Okay, so flu vaccine every year. Herpes zoster if you're over the age of 60 because of varicella. If you've had chickenpox as a child, there's what you call shingles. You've seen the adverts on TV, so there's a vaccine for that. Tdap is diphtheria, tetanus, and pertussis. A lot of you have grandchildren, so this is not actually for you. Part of it is for you, but the pertussis is for your grandchildren. That's whooping cough. Okay? The tetanus, if you get a cut, you don't take care of it, you could get tetanus, and that could kill as well. Varicella is the chickenpox if you're an immunizer, you never had chickenpox before. Hepatitis A and B vaccines, like I said, they're quite common. There's no cure for hepatitis B or hepatitis C. And then risk factors, pneumococcal and meningococcal vaccines. Okay, so people that have COPD, asthma, they need to get the pneumococcal vaccine.
How often do they get that?
I'm not sure, every couple of years. Okay? Now, so then we'll go over to age 65 and older. So the same thing when you go to see the doctor, it's still the same thing that we're going to do for you, but I just put here more common issues that they may be experiencing. Menopausal symptoms, sometimes the hot flashes tend to linger, they become more troublesome, vaginal dryness, you know, it may be disturbing and you may want something for that. Also, I didn't put the vaginal bleeding. Now, if you've gone through your menopause, you stopped having periods for a year, and you start bleeding, that is abnormal, and you need to see your doctor immediately. Okay, because that's a sign of cancer. It's one of the symptoms that uterine cancer presents with, is postmenopausal bleeding. So that's very important. Pelvic prolapse. Some people report pelvic prolapse. They feel, oh, I can feel something coming out, like a ball coming out of my vagina. That's one of the things that happen. Urinary incontinence is common as well. When you're coughing, you're sneezing, you involuntarily leak urine. Sometimes fecal incontinence as well. If you've had like a difficult labor years back, you know, you've had like a very long labor, you had a very nasty tear, you had complications, you have risk of fecal urinary incontinence. And then cancer screening. So we talked about the vaginal bleeding, okay? One of the things that in cancer screening as symptoms, ovarian cancer is like the second most common gynecological cancer, but it's the most common killer in women. And the reason being because the symptoms are non-specific and we don't actually have a good screening test for that right now. So most people will tell you they've had a couple of symptoms for like months before. So usually abdominal pain, pelvic pain, some bloatedness, they feel full very easily, you know, you just feel your tummy getting bigger. But those are non-specific things. It could mean a lot of things. And then you go see your doctor. Your doctor thinks, okay, let's take a history. If you've had a family history of breast cancer or ovarian cancer, that could put you at risk already, because some of the ovarian cancers, they run in as hereditary as well. So they do a genetic screening. So if you have a history of breast or ovarian cancer, it's very important to have your mammograms. You see your doctor every year. You let your doctor know, because they can offer you genetic testing. There's something called the BRCA gene. If you have the BRCA gene, you're at risk of getting breast or ovarian cancer. How many of you heard about Angelina Jolie getting double mastectomy? So that's one of the reasons why. Because she was at risk of, she has a BRCA gene, so she had a mastectomy, and she had her ovaries taken out to reduce that risk. Okay? Vulvar or vaginal cancers, those are pretty rare, but then they could happen. So most times you notice that you have an itch down there that you just can't get rid of. Or you notice there's a new spot, slightly raised, discolored, velvety patches or scaly plaques or anything like that. Those are reasons to see your doctor and tell them, okay, I noticed this and it doesn't feel quite right. What else? Colon cancer, rectal bleeding. Okay, same thing, abdominal pain, non-specific. Okay, these things, most of these cancers are curable. At least it doesn't mean that cancer is not a death sentence anymore. Okay? And then of course we have the family history, medical history, nutrition to make sure you're eating okay, you know, you're the right weight. A lot of people, as they get older, they tend to lose weight and shrink. Okay, because they're not looking after themselves as much. Okay? So a lot of people try not to eat as much. You know, I'm sure if I ask you guys now what you had, if I ask what you had for breakfast, lunch, or dinner yesterday, you tell me, oh, I just had a little bit of this, a little bit of that. I didn't really feel like eating much, you know. But we have to make sure you're getting the right kind of nutrients. And then psychosocial. So we go back to the smoking, abuse, neglect. Okay? It's something that people don't like to talk about, but sometimes, you know, you may have a caregiver who's looking after you and who's supposed to be looking after you, but instead of looking after you, you know, they're being neglectful. You know, neglect is a form of abuse. Not making sure you eat properly, not making sure you have a shower in the morning, you know. Those are things that are signs of elder abuse. And it does happen, so we have to talk about it and we have to ask about it. The physical exam is similar. Like I said, we'll do the breast, the abdomen, the pelvic. Now, I put here, you may discontinue a pelvic exam if you've had a hysterectomy for a benign reason, like you've had a hysterectomy for fibroids or prolapse, not for cancer, okay? So, but if you've had a hysterectomy for ovarian cancer, you still need to have a pelvic exam, an abdominal exam, just to see if there's nothing there, no recurrence. And then, I put there, another reason is that sometimes when you go to see the doctor, depending on what the symptoms or what you find, we have a discussion with the patients. Now, would you like to investigate the symptoms? For instance, if you're in your 80s and you come to me, if you're in your 70s, maybe mid-70s, you've had a history of a stroke, you're in a wheelchair, you have hypertension, you have diabetes, your quality of life is not so good right now. And then we find out you have vaginal bleeding. Now, is it worth it to investigate that vaginal bleeding? Because you're more likely to die earlier from the complications that you already have than from the cancer. Because if we start to investigate and treat the cancer, would you want us to investigate and would you like to treat the cancer if you were to find out you have cancer? These are things that you have to discuss with your doctor. So sometimes people find it hard to go in between because, you know, like you have family members, you have elderly mothers, you know, some mothers are in the 90s or something, and they have problems, or she has a prolapse, and you think, oh, she needs to get it fixed. But is it worth it? The risk of surgery, the risk of anesthesia, is it actually worth it? Chasing that one problem. It may not be cancer, it may just be something like a prolapse or incontinence. Is it actually worth it, chasing that problem, as compared to her quality of life? Because you may do more harm than good. Okay? And then, like I said, once you get to 65, U.S. Services of Cancer Screening recommends age 70, but from 65 to 70, you can have a discussion with your doctor if you've had a history of negative PAP. Do you still want to have a PAP test? Okay? Same thing with the mammogram. So those are the basic things that we would do as a well woman. But I think that's it.